Hello. Today we will be talking about psychotic disorders and the subtle differences, splitting schizo-hairs. When we talk about psychotic disorders, it looks at a range of conditions characterized by the disruptions in thinking, perception, emotions, and behavior. We've got to understand the nuances between each of these disorders, as that's critical when approaching people in mental health, and specifically whether it be a counselor, psychologist. When we look at psychotic disorders specifically, they're mental health conditions that impact an individual's ability to perceive reality accurately. Some of the key features of psychotic disorders include hallucinations, delusions, disorganized thinking, and impaired functioning. And then when we lean into the symptoms, they can significantly disrupt an individual's life, and it may require intensive treatment and support when we look in the broad scheme. But we need to look at this from a diagnostic perspective, and then when we distinguish between really three areas: schizophrenia, schizoaffective, and schizophreniform. The DSM-5, it defines schizophrenia as a chronic, severe mental disorder characterized by hallucinations, delusions, disorganized speech, extremely disorganized behavior or catatonic behavior, and also goes into cognitive impairment. And that's according to the APA. And again, when we look at the DSM-5. In Dr. Marks's video, she reflects on these deficits, the cognitive deficits, as being memory, organizational problems, and impaired thought processing. We also read through the DSM-5 that it typically develops, can be late adolescence, early adulthood, but there's a wider range, but that's typical there. And obviously it has significant social and occupational dysfunction. Dr. Marks also states that two of these symptoms must be present to be diagnosed with schizophrenia. There's also a time frame listed on that, and we'll cover that more, usually more than a year. Schizophrenia requires the presence of symptoms for a certain duration in order to meet the criteria labeled. Reading an article, really the schizoaffective disorder, the author Dewey defines schizoaffective disorder as symptoms of schizophrenia, really with mood disturbances such as mania or depression. Individuals with schizoaffective disorder experience a combination of psychotic symptoms and mood symptoms, and essentially it's often misdiagnosed, or it's challenging to differentiate from other disorders due to an overlap of symptoms. But what we see is it really leans into the mood disturbances. And then schizophreniform disorder is a relatively rare condition that shares similarities with schizophrenia, but is much shorter in the duration. According to Bannon in 2024 and other authors, it states that to meet the diagnostic criteria for schizophreniform disorder, symptoms must be present for a specific period, which is typically between 1 to 6 months. So anything longer than 6 months is they lean into schizophrenia. If symptoms persist beyond this time frame, the diagnosis could change. In listing the diagnosis, when we look at psychotic disorders, specifiers and modifiers, obviously they play an essential role for the individual's, the understanding of the individual's condition. Specifiers are additional descriptors that provide more detailed information about the specific features of the disorder. And for example, a specifier may include predominant symptomology, such as like a paranoid type, or the presence of hallucinations, or even delusions. Modifiers, they highlight additional factors that may impact the course of not only treatment but the individual. They can include considerations such as what level of insight, the severity of symptoms, and really looking at the modifier, the response to treatment, including specifiers and modifiers. Both must be looked at in order to help practitioners or clinicians with interventions, and as well as the unique presentation and needs of each individual. Obviously, there's subtle differences between psychotic disorders, but we've got to pay attention to those for accurate diagnosis and effective treatment. Understanding the diagnostic criteria, the associated features, the prevalence of certain attributes over the development and the course of schizophrenia, schizoaffective, and schizophreniform, it will help aid us in really putting a plan in place. And when we incorporate specifiers and modifiers in the diagnostic process, we kind of gain a more comprehensive understanding of the overall view of the individual symptoms, and in the end, tailoring any treatment plan or interventions to that individual. Thank you.